where I talk about it, people are usually like, I can't believe you do all this stuff under one roof or within one organization. So hopefully I can kind of shed some light about who we are, what we do, how we do things. I thought I was prepared. I printed out my PowerPoint with all my slides, and I left it. So we're gonna wing it, and hopefully I know enough about my organization.
Here's a good way to click forward. Just pull this wheel button.
Cool. Okay. So I always like to talk about family health centers first by talking about the community health center movement in this country. It's a piece of fascinating history. Most people don't know about it, but it really provides context for who we are as an organization and other community health centers. So community health centers were started in the mid-1960s under Lyndon B. Johnson's War on Poverty. It was a social justice, civil rights effort to really just bring access to medical care to poor communities. And there was a gentleman, Dr. Jack Geiger, who had just come back from rural South Africa, where they had hundreds of community health centers and otherwise impoverished communities. And when he came back, he was like, we need something like this in our country. This was a time when most healthcare was hospital-based. If you didn't live near a hospital or didn't have a country doctor in your area, before EMTALA, before Medicaid. So access, especially access for the poor, was incredibly difficult. So Dr. Jack Geiger had a great idea, was to create community health centers, local-based, integrated with people from the community, majority run by patients, and two were started in 1965. One was in Dorchester, Massachusetts, in a public housing complex, urban, but 3 hours isolated from the nearest hospital. And the other one was one of the poorest Black counties in the country, where their infant mortality was more than 90 per 1,000. In community health centers, their primary goal during that time was to reduce the biggest barrier to care, and that was the cost of care. This is easy to do this. No, okay. And the font gets all screwed up. That's why you can't see it all. But our mission at the Family Health Centers mirrors that same original mission of community health centers. We provide access to high-quality primary and preventative care without regard to the ability to pay. And community health centers across this country share the same vision today. This is something that a common thread that binds us all. And we do that primarily through our sliding fee scale. So we're going to look at your family size, your income, and we're going to put you on a sliding fee scale and scale that to what you can afford. If you're at or below poverty, our minimum fee is $20. Did not turn out great. Community health centers were so successful in their mission. There's nearly 1,400 different organizations across the country, and we serve more than 28 million people now annually. And the majority of our patients, even today, are low income or living in poverty. About 75% of Family Health Centers patients today live in poverty. Hold on, we're just going to play real quick. So I had another note there. There's 24 community health centers in the state of Kentucky, and we have 3 here in Louisville. That's Family Health Centers, Park DeBall Community Health Center, which was started in 1968, making it one of the oldest in the country. It's pretty great. And then Shawnee Christian, is our newest. So, Family Health Centers, we were started in 1976 under the Louisville Board of Health. And the Louisville Board of Health is still our parent organization. They appoint all of our Board of Governors to our board. We're a nonprofit healthcare system. We're quasi-public. All of our staff are hired through Metro Civil Service, which is unique to Family Health Centers. And we have the federally qualified health center status, which is now what the Community Health Center program is, named through our federal statutes. Through our Section 330 grant, we become an FQHC. And with that, we get certain baseline funding that helps us offset the we also get other benefits like FTCA, which is a medical malpractice coverage, and other sorts of things too. It helps us balance the scales. We serve more than 40,000 patients annually across 8 locations. I mentioned this before, the majority of our Board of Governors is patients. This is another unique thing to community health centers. It's part of what makes us part of the community. We have to have the majority of our board patients. They have to come from the neighborhoods that we serve. They have to use our services. So I rigged this up to have a little thing to go around. We'll see if I can do it. Okay. So what would have worked if this was going on is I would show you the different constellation of services. So I'm just going to have to remember them all, and then we're going to go through some of the specifics on each of them. So at our core, we are a primary medical care facility. We offer care for the entire family, babies, adolescents, women's health, adulthood. That's who we are fundamentally. But with that, we also offer a constellation of services to really address multiple parts of a person's health. In addition to primary care services, we have dental services. We operate 3 dental locations. We have an integrated behavioral health services model where we have LCSWs and case manager services integrated with our medical services. We have labs on site at all 8 locations. We offer radiology at our Portland site. We have outreach and enrollment workers. These are folks who are going to help people enroll into Medicaid or healthcare.gov. They're gearing up for Kentucky Health implementations. They're going to act as navigators for patients on that. We also offer, I'm going to forget some things, comprehensive health education services. So we have yoga and Zumba and meal prep on a budget and diabetes management, chronic disease management, and prenatal classes and birthing classes. You name it, we have it, and we offer it across multiple locations, and it's not just for our patients, it's for people in the community as well, too. I know I'm missing one, but I'll figure it out as we go along. Okay. No? So as I mentioned, we're a primary care provider. Adult medicine, pediatrics, we're a vaccines for children provider. Women's health services, prenatal care, family planning services. We're the only Title X services provider in Louisville right now. So that's family planning services, STD, pregnancy tests, all of that free or on the sliding fee scale. Dental care, so we are a phase 1 dental facility. The nominal fee for our dental care is a little bit different. It's $30 for people who are at or below poverty. Again, we never turn people away if they are unable to pay for our services. We treat kids through adults. We can handle people who have mobility issues or mental health issues or emotional issues.
This is phase 1, that first line means.
That's like primary and preventative care, so cleanings, fluoride treatments, sealants, extractions, x-rays, oral health education. We don't do dentures, for example. We don't do reconstructive. That's essentially phase 1. And we have 3 locations, our East Broadway, which is right around the corner from here, Portland, and then our Healthcare for the Homeless site. So we operate an integrated behavioral health care model, meaning to access our behavioral health services, you have to be a medical patient. And what happens is we do, whether it's doing a PHQ-9, a depression screening, or an anxiety screening, or just in conversation with your PCP, if things come up, they'll pull in our behavioral health specialist on site because we know the best time to give someone care is when they're standing right in front of us, right then and there. It's much easier to get them on that treatment path and trying to get them to come back for services. So our behavioral health services integrated. This is also where we'll make referrals to our case management services. So you all are case managers, I don't need to explain what that is, but we do have on-site case management services and social services for our patients as well too. This is no additional cost to our patients.
You mean you charge for dental and medical, not behavioral health?
Since it's integrated into the medical services, it would be included in those base charges, but no, we wouldn't add additional cost for those services. You do have to be a patient, a medical patient to receive behavioral health services. You don't have to be a medical patient to have dental services. You can be both, but you don't have to for dental. So substance use services, this is a new area for us. We've been doing some substance use services for a long time with our Phoenix Healthcare for the Homeless, but most recently in 2016, we expanded to add medication-assisted treatment services. And I do specifically have a handout over here on our MAT services. We use Vivitrol, which is either a once daily or a once month shot. The shot blocks the effects of opioids and alcohol. In order to be on it, you have to be fully detoxed. You can't have any opioids in your system. But it decreases your cravings. So our program, some people come to us just for the medication maintenance portion of it, especially if they're in counseling services elsewhere through a halfway house. But we also offer our behavioral health services counseling in conjunction with Vivitrol services as well too. And we have funds, so we will help you enroll into Medicaid or other health insurance if you need it to help cover the cost. Then we will also cover the cost of the shot as a bridge if you need to have that as well too. We have that kind of built in to our program. You do have to we will help you establish medical care with family health centers in order to enter this program, because we do labs and we do pregnancy tests and we do a lot of follow-up on the medical side of it too. So you do have to be a medical patient, but we will help you do that. Pharmacies. We have two 340B pharmacies and one going online very soon. And 340B is a program that federally qualified health centers and certain hospital systems can take advantage of. And it basically means that we can sell our medicines to patients at a deeply discounted price, much more so than a lot of other folks can. And we also partner with, in contract with Walgreens and other private pharmacies in the community in order to extend those same discounts to our patients. So, because I work with family health centers, I get that same drug too, or access to it as well too. And a medicine for my son who has asthma would cost me $90. I pay $4.50 a month for this medicine. I have paid 26 cents for a Z-Pack with this program. You know, we believe, and if you've worked in healthcare long enough or any of these kinds of fields, you know, there was a time, especially before the Affordable Care Act, where people would ration their medicines to get them through the end of the month, where the cost of their medicines was a true barrier. And just like so much else with family health centers, we don't want the cost of care to prevent you from getting the medicines you need when you need it, or seeing your doctor when you need it, or seeing a dentist. We also operate a prescription assistance program, and these are for folks who are truly uninsured. It's completely funded through donations by family health center staff. So you're in the pharmacy, and this happens through our pharmacy because we're the only ones that sign off on it, but you're in the pharmacy and you don't have the $10 for your prescription, we will take care of it. We also operate clinical pharmacy services. This is through a partnership with Sullivan University, where we do enhanced diabetes education programs, especially for our newly adult diagnosed diabetes patients, teach them how to give themselves insulin shots and measure their blood sugar and monitor their diets and exercise. And we also monitor our Coumadin and Morphin patients as well too, because it's a high-risk medication and patient group. So those are folks who will come in, sit down with these clinical pharmacists, have extra labs done, and they can adjust their medication on the spot then and there.
Would you make sure that they get their medicine, what they need? You'll make sure they get the insulin or whatever they need, you'll make sure they get that.
In terms
of the cost, with that additional
Through the pharmacy services, it shouldn't be any additional costs, but if you've heard differently, let me know. But no, they teach them how to do their medicines within that program. So they'll show them how to do the injections, how to do the test strips, all of those sorts of things. And you can purchase, and you can purchase all of those supplies through our pharmacies as well too, at a discounted rate, yes. Yes. And the prescription assistance program too really targets those like must-have medications. Community health workers, this is a new area for us. These are trusted lay people who really kind of meet patients where they are. Meaning there's a lot of need that individuals have that we might not identify in the health center or can't address in the health center. So we have 2 individuals who are community health workers. One works for the general patient population and the other one is a refugee health focused. So she's fluent in 5 languages and she works mainly with Swahili, Somali, Kirundi, Rwandan. She also speaks French. So a number of different folks. And these folks will go to your home, they'll meet you out in the community, and it's really about addressing those basic needs that we don't always think about. One of the stories we have from a worker was, we had a patient, she wasn't showing up to her appointments, and it was because she didn't have clothes that fit her. And so she was embarrassed to leave the house. And so she helped her find clothes that would fit her. She was scared to leave the house for the first time, and so she would take her out of the house to get her to her comfort level. It's things like that that we know maybe is going on, but we can't really do anything from our 4 walls. And community health workers is a way to sort of bridge those gaps. Two of our locations are specialty population focused. Phoenix Healthcare for the Homeless over on Muhammad Ali, right next to the St. John Center. This is specifically for people who are homeless or in transitional or peer supported housing. The cost for services at Family Health Centers Phoenix is nothing to our patients. If they're insured, we'll bill their insurance, but otherwise, except for co-pays, Medicaid co-pays, we will ask for those, but again, we will not deny people services. This has enhanced behavioral health services. Many of our homelessness community have serious and persistent mental illnesses, combined with substance use services. We also operate a RX housing program, which is a peer supported, permanent supportive housing program. That's a lot of words. Well, we have housing vouchers for people, and we will actually house people indefinitely, permanently, with peer support to help them get there. And when we do that, we just don't put people in apartments. We buy them furniture and towels and dishes and pots and pans and everything that you need to restart your life. And our peer support folks, these are people who really kind of come in. You know, a lot of the folks who are homeless, they're estranged from their families. They forget how to use things like the grocery store or get their licenses. And our peer support specialists really are just their guides in all of this. Our Family Health Centers, Americana, there's two places, University of Louisville and the Family Health Centers, who does refugee health assessments for our newest neighbors. And this is a in-depth two-visit assessment. Make sure people are all update on their vaccinations, make sure that we get them medical care that they need, a lot of background tests and everything, and we're one of those locations that does that. And with that, we also do a comprehensive orientation to the U.S. healthcare system, because our system is radically different than where a lot of people are coming from. And we think it's very important to kind of give them that baseline. What's health insurance? When to go to the emergency room versus an urgent care facility. All of those sorts of things. We have behavioral health services, case management, kind of enhanced case management services. And we just recently took on the Survivors of Torture program as well too. So this is an enhanced behavioral health services for individuals who, a trauma-informed care service base for individuals who have been tortured by the governments or by the military and things like that. So our original mission, you know, we want to take away the primary barrier to accessing medical care, and that's the cost of care. But at the end of the day, you know, especially today, especially with the expansion of Medicaid, that's not the same barrier that's not the primary barrier anymore. So we try to look at a number of different things that might prevent people from accessing care and try to build bridges to that. We offer evening and weekend hours. You know, maybe you work during the day, you have hourly, you get paid hourly, you can't take off or don't have that ability to take off. We have evening and weekend appointments available. We offer a Lawyers for Kids program, which is a pro bono lawyer for civil issues, so tenant issues, landlords, custody issues, those sorts of things. We're going to link you to the Lawyers for Kids programs, and they're actually on site at 2 of our locations. Comprehensive Interpreter Services program, we have about 13 in-house Spanish interpreters, and then we provide our services in over 40 languages, and more than 30% of our encounters now are with patients with limited English proficiency.
Are they free?
Absolutely. It's actually the law that we provide interpreter services, and so this is just, well, FYI for you all, if you ever get pushback or people tell you, oh, make sure they bring an interpreter, if they accept federal dollars, especially Medicaid or Medicare, they cannot charge patients or tell them to bring their own interpreter. It's the cost of doing business. We pay for the interpreter services, and it's our duty to. Transportation help, cab vouchers, bus tickets, those sorts of things. We are working with the Louisville Primary Care Association to apply for a grant to hopefully offer enhanced transportation services, because this is a major issue in our community, and I think most of us probably recognize that. I mentioned our health education and exercise classes. I brought for you all an array of papers for you to take, and with it I have our family and our family class schedule and our general health education class schedule. I have a flyer with our dental services locations on there, our medication assisted treatment program on there, and just an overview of who family health centers are, and then both a brochure in English and in Spanish for you that includes all of our locations and how to get an appointment. Dare to Care Food Bank, we established a partnership with Dare to Care last year, and through a social determinant screening program, you know, where we ask people about their food insecurity, transportation, and a lot of other different things. We've identified food insecurity is still huge amongst our patient population, and today we've given out over 40,000 pounds of food through our health centers. We have it embedded in five locations right now. And that really tees us up to Unite Us, which, as Jan mentioned, this is going to be a program through Metro United Way and a number of different partners, probably with some folks here in the room, but doing that social determinants of health screening, you know, and we're already doing the case management, but then we're going to be launching the Unite Us, which is really an enhanced, robust referral tool that will allow us to both receive referrals from you all in the community, and then also be able to give out referrals to folks in the community and to be able to track it. Because we know giving out a piece of paper to our patients who live chaotic lives, it might not always get done. Okay. Who do we serve? Everyone. We welcome everyone to family health centers. People think they don't qualify for our services. You know, we all experience barriers to care. We want to be the bridge to those services. So whether or not you qualify for a sliding fee scale, that's a little bit different, but we're never going to turn anyone away. But just see, our sliding fee scale goes up to 200% of federal poverty level. So we're Joint Commission accredited for our labs and ambulatory care services. We're also a certified patient-centered medical home as well too, through the Joint Commission. But that's my presentation. Hopefully you've learned a little bit about family health centers and community health centers. And if you all have any questions, I'm happy to answer them. Yes, sir.
I first have to say that I'm a patient of Phoenix,
Okay.
and I became a patient over the summer last year. Have been absolutely astonished and amazed at the level of treatment that I have there. Dr. Robert Boyda.
Well, yes, Dr. Gordon.
He's a phenomenal doctor. He's not a pill pusher. He's very compassionate, takes the time to listen. You may have an appointment at 1:30, you may not get back there until 3:30, but that's because he's giving everyone the appropriate amount of time for their care. Molly Hill as the site nurse, and I did see Tim Walsh for a period of time. Phenomenal treatment team over there. I couldn't have asked for better when I was homeless and on the streets, and they were all very diligent in working and getting my housing voucher and getting me back on my feet. And then in getting that, I am now a member of the Consumer Advisory Board.
Oh, wonderful. Excellent.
We meet on the first Wednesday of every month at 1 o'clock, and learned a lot about FHC from sitting on that board. And with mentioning the Vivitrol treatment,
Yes.
I know that Vicki Serino came in a couple of meetings ago and said that we were going to visit, starting with Vivitrol treatment. Felt that we were having a little bit of backfire from sending people to JDAC or Sunshine for sobriety because they had participated in their program, but then because they were doing Suboxone and coming to us for Vivitrol, it was backfire.
Yeah, you can't be on Suboxone and Vivitrol. That wouldn't be a good mix.
Have we resolved that issue yet, or are we on a better network with Sunshine on that matter?
That's a good question. I don't know. With Vivitrol, one of the reasons why we decided to do Vivitrol as a medicated assisted treatment program was that it's not addictive. It doesn't get you high. It doesn't, Suboxone and methadone and those sorts of things, there's a street value to it, and that's not the same with Vivitrol. So if someone wants to it sounds like some of the problems might be that people are trying to dip in a couple buckets. And we would want to be careful for patients, in that regard. But I'm not, I'll talk to you afterwards and follow up. Phoenix is a little bit different too, where we might actually at some point offer methadone treatment for Phoenix patients specifically. But you bring up a great point, and that is, healthcare for the poor, for the underserved, doesn't have to be for healthcare. Our mission is to provide quality healthcare services. So, and Dr. Boyda and Tim and Vicki, they're all fantastic. Yeah, thank you for saying that. Yes.
I work with individuals with challenges that are always looking for employment, and I was wondering, with this many locations, do you have a lot of employment opportunities? Are you in need of employees at entry-level positions or even training positions? What is that looking like?
Yes. We definitely we do comprehensive training for our folks, even at entry-level positions, because we're on an electronic health record and it takes a lot of hands-on. Front office specialists, medical record specialists, people who can become familiar with computer systems and help us with, just the data, going paperless. We know it's not really paperless. A lot of scanning involved, a lot of tasking. But that is something that, especially if you have people who want to work, I'm happy to talk to you about that. But yeah, we hire frequently for front office, medical receptionists, medical assistants, and there's an employment shortage. So if you've got an excited group, I'm excited to talk to you.
Okay, great.
Yeah. So the way that we do that, we actually ask you questions in your exam, and we ask you a screening tool like, I don't know the exact questions, but have you ever been worried about running out of food in the last 6 months? Do you want, and if they say yes to that, we offer them a food bag then and there. So it's not at like a physical location where you can come and pick up food. We're actually doing it during the medical visit. And then what we also do is follow up with, the local resources to food banks and things like that. And then now that we know that you have food insecurity, it's something that we're going to be talking about at a free visit.
Thank you.
Do you have a phone number for the in-home medical visits?
For the community health worker, I can get you their numbers. Yeah, I can get you their numbers.
We'll make sure they go out in my notes.
Well, thank you all. Thank you all for the work.